the gross or macroscopic examination of stool specimen. In this activity, we will be after of two things: the color of the stool and consistency of the stool. Gross examination of the stool specimen may also provide the opportunity to recover tapeworm prolutids or adult worms, in particular Ascaris or Enterobius, from the surface of the specimen or in the container. Tapeworm prolutids may be found on or within the specimen. Terms used for the consistency of stool specimen, and we also have the references. Consistency like hard, it cannot be punctured with an applicator stick. Formed, it maintains shape, can be punctured with an applicator stick. Semi-formed, bottom side flattens in the container. Soft, can be cut with an applicator stick. Mushy, can be reshaped with an applicator stick. Loose, stool shapes to the container. Diarrheic, stool will flow slowly out of the container. Watery, fluid-like stool pours out of the container. Materials needed are fresh human stool sample and applicator stick. For the procedure, using an applicator stick, poke all areas of the specimen and take note of the color and consistency. Record result. For the reporting results, you have to take note of the name of the patient, the date examined, the age, the gender, and then the macroscopic examination that contains the following: color, consistency, and the result. And who is the examiner or the medical technologist. For the next activity, we will perform wet mount. Wet mounts are recommended for the detection of motile trophozoites when liquid or diarrheic specimens are received. The direct wet mount is performed to detect motile protozoan trophozoites and to determine cellular morphology. The materials needed are the following: stool sample, microscope, clean glass slides, applicator stick, cover slips, marking pens, NSS or normal saline solution, or 0.85% sodium chloride solution. The composition of the NSS are the following: 0.85 grams of sodium chloride powder and 100 ml of distilled water. For the procedure, on a clean glass slide, place a drop of saline solution. Using an applicator stick, pick about 2 milligrams of feces, enough to form a low cone at the end of the wooden applicator stick, and mix with NSS. The feces should be thoroughly comminuted in a drop so that a uniform suspension will spread evenly to all edges of the cover slip. Cover with cover slip and exclude bubbles. Examine the entire preparation systematically and thoroughly under the microscope using the low power objective. Confirmation of parasites can be made by switching to high power objective. For helminths, positive result is reported as number of eggs with the name of the helminth per cover slip, or in pluses and no ovacine for negative result. For protozoa, positive result is reported as positive for the name of the protozoa and the stage, and none-seen for negative result. Take note, a properly prepared DFS or direct fecal smear will allow ordinary newspaper print to be barely legible through the preparation. Too thick a smear will make microscopic observation difficult, while too thin a smear will make examination unsatisfactory. For the next activity, we will go now to the D'Antonis method. The D'Antonis method is performed to detect protozoan cysts. Their morphologic appearance is enhanced clearly with the addition of iodine solution, which act as stain. The materials and reagents are the following: microscope, stool samples, clean glass slides, applicator sticks, cover slip, marking pens, and the D'Antonis reagent. Composition of D'Antonis reagent are the following: potassium iodide 1.0 gram, iodine crystals 1.5 gram, distilled water of 100 ml. For the procedure, on a clean glass slide, place a drop of D'Antonis reagent. Using an applicator stick, pick about 2 milligrams of feces, enough to form a low cone at the end of the wooden applicator stick, and mix with the reagent. The feces should be thoroughly comminuted in a drop so that a uniform suspension will spread evenly to all edges of the cover slip. Cover with cover slip and exclude bubbles. Examine the entire preparation systematically and thoroughly under the microscope using the low power objective. Confirmation of parasites can be made by switching to high power objective. For helminths, a positive result is reported as number of eggs with the name of the helminth per cover slip, or in pluses, and no ovacine for negative result. For protozoa, positive result is reported as positive for the name of the protozoa and the stage, and none seen for negative result. You have to take note that a properly prepared smear will allow ordinary newspaper print to be barely legible through the preparation. Too thick a smear will make microscopic observation difficult, while too thin a smear will make examination unsatisfactory.